sometimes, just the uncertainty of knowing whether a trial is going to work or not can even add to that feeling of stress. Do clinical trials ever include any provisions for mental health issues, ways to handle this type of stress?
It's interesting. I've actually had a lot of patients tell me that the clinical trial nurse ends up being like their therapist because they're talking to them so often and they're really going through all of the side effects, and they're really trying to think about not just the physical side effects, like, nausea or, peripheral neuropathy or numbness and tingling, fatigue, but also, things like, how someone's mood is, and maybe anxiety, depression, and thankfully quality of life, and some, essentially the lived experience of having cancer and going through a clinical trial is increasingly being documented in clinical trials, which is so incredible. I would say in terms of the actual provisions to provide mental health care, those are so essential that if you're having stress, that if you're having, depression, if you're feeling blue, beyond the understandable anxiety of having a cancer diagnosis and going through treatment, that you should seek appropriate care. Number one is always, take care of your own mental health, and that should be covered under your standard mental health care. For health insurance under the Affordable Care Act, mental health care is one of the essential benefits that is covered. I have not seen, and maybe my colleague can help, I've not seen a specific clinical trial where that was written in to the budget, though.
I have not, but I think it's it's an area of unmet need is what I can tell you. I think it's as we move forward, with increased healthcare burden and a lot of other financial issues that come up, mental health issues that come up during cancer care, because there's the patient and then there's the caregiver. I think more and more clinical trials in time will hopefully try to address this issue of, accommodating this aspect of mental health care as an integral part of clinical trial. But so far, I have not seen, to the best of my knowledge, clinical trials that account for this or take that into integral consideration.
I agree. I mean, it's definitely an unmet need and something that I would love to see be included in clinical trials in the future.